Chemotherapy is medication that is given through the veins in effort to treat your cancer. What we want to do is have a way to give you those medications reliably and safely. One of the difficult things in placing IVs for this purpose is that many times chemotherapy needs to be given repeatedly, and oftentimes the chemotherapy medicines can be a little bit painful to give through smaller IVs and also can cause vein scarring, which can lead to a problem down the line where we run out of veins to start IVs on. To avoid these problems, oftentimes we place a venous port, which is a small device that's typically placed on the upper part of the chest that serves as like an artificial vein that can be accessed many times, up to thousands of times, and allow for reliable venous access for both blood draws and for medication infusions, and for your case, most commonly for the chemotherapy. Shortly after getting registered as a patient in the hospital, you'll be brought to our pre-procedure area where they'll be evaluating you for any problems that you might be having outside of your normal state of health and getting you ready for your procedure. That will involve getting you changed and starting an IV so that we can give you some medications during the procedure to help keep you more comfortable. Typically, we perform these procedures with something called moderate or twilight sedation to keep you comfortable while also keeping you safe. The procedure is very well tolerated, and typically the most uncomfortable part of the procedure is actually the local anesthetic that we give, which causes a little bit of a burning sensation which lasts about 4 to 5 seconds before subsiding. After that, you will feel the pressure and sensation of somebody touching you, but we try to minimize and avoid anything sharp or painful. Because you're under what we call twilight sedation, you'll be able to let us know if you're feeling anything that is sharp or uncomfortable, and we can always give you more medication, either IV or local anesthetic, to help keep you comfortable. After the procedure, you'll come to our recovery area for an hour to recover from those medications. We'll be checking on you and making sure there's no post-procedural problems. After that hour, you'll be free to be discharged either to another medical appointment or home. The port is made up of two components. There's a hub portion and a catheter portion, which you see here. The hub portion is where the port is accessed through the skin, and because it's connected to the catheter, that allows them to draw blood or give any kind of IV medications through your port. In your case, it'll be most commonly used for chemotherapy, but it can be used for any purpose that an IV would be needed for. What's important to realize is that you'll have two incisions made at the time of the procedure. One will be at the base of your neck where the port catheter will go into your vein, and the other will be on the upper part of your chest where the actual port hub will be placed. Going forward, the hub port will be the area that you get accessed into. There's a couple different things that sometimes people do to help make that process as pain-free as possible. One option is a topical lidocaine jelly, which is sometimes prescribed that is placed about an hour before the port is accessed. And the other option is just icing the area prior to having the port accessed. Typically, the port is a little bit tender following insertion for about 2 to 3 days, but typically doesn't require any sort of medication or any sort of extra care to help with the healing process. The port can be used as soon as the same day it's placed if your chemotherapy start date is a little more urgent, or it can be used anytime after that safely. Your port can stay in for many years if needed, and it can be removed after just a few months if needed. All depends on how your treatment goes and what the overall requirements of your care are. The process to take your port out is pretty similar to when we place it, obviously just in reverse with the port coming out instead of going in. Like any procedure, there's risks and benefits involved in this sort of procedure. Some of the small risks involved in this sort of procedure are primarily bleeding and infection at the insertion site. Those are both very rare to have significant problems with, on the order of less than 1%. Before you leave, they'll go through a packet on how we typically recommend you take care of your procedural site. But more or less, we'd like to keep the area dry for about 2 days. You'll have a white bandage that is on top of your incision. Following those 2 days, you can take the bandage off, and right on your skin, you'll notice that you have a clear, shiny material, which is a medical glue that helps close your skin. This comes off on its own over the course of 1 or 2 weeks. It's important that you don't scrub on or pick at that glue and just let it come off naturally, but you are able to get that area wet like in a shower, but not submerged like in a bathtub. After the glue has come off, it's safe to do whatever you'd like in terms of activity, both showering or bathing or swimming.